computer. Thank you. So we want to welcome today Donna Torney, who is a licensed mental health counselor based in the Washington Valley. She uses cognitive behavioral therapy and other mindfulness-informed tools to treat individuals who are seeking to manage anxiety, depression, trauma, and interpersonal struggles. In addition to her formal training in psychological counseling, Donna has studied with many leaders in the fields of contemplative neuroscience, yoga therapy, and meditation. She is passionate about combining Western psychology, mind-body awareness, and researched contemplative practices to offer a unique approach to therapy and wellness. We are very happy to welcome Donna Torney today, who's going to give a presentation on seasonal affect disorder. Welcome, Donna.
Thank you. And thanks for having me. And Catalina, I really appreciate you getting me in your August meeting, because I think when we first talked, I was hoping we could talk about it sooner than later. That's one thing that I see often in my practice is people come in, November, December, and they're already in hibernation mode. And one thing that we'll talk about today is that we can the nice thing about this particular mood disorder is we can kind of predict when it's going to start, and we can do a lot to be preventative. So I'm going to share my screen and try to go into full screen here. I'm not the best with Zoom because I use a different server that's HIPAA compliant for my video call. So let me know if there's any glitches, but let me give this a try. Okay. So, let me get this view. Here we go. There we go. So hopefully this will work. Okay, so getting ahead of seasonal affective disorder and wintering well. So some of the key points here today, like I said, I would like to see us all preparing early, knowing the symptoms, understanding the treatment modalities, and personalizing your treatment plan. And just remembering to normalize this and remember that we're not flesh-colored computers, and we really do have to pay attention to the seasons. It doesn't really matter if we're talking about, full-blown clinical seasonal affective disorder or just a little bit of the winter blues. I think it's good for us to all be on the same page in terms of we're human beings, we're mammals, we're still affected by the seasons. And I think one way to help, especially young adults, is to let them know that this is normal to have different ebbs and flows over the year. And unfortunately, we live in a culture where there's a push to be on all the time. But if we can kind of talk about normalizing ups and downs, I think that's really supportive and helpful. So normalizing is a big message I want to get across today. And on that point, oops, let me just go back. So in terms of being preventative and starting early, I wanted to show this slide to you where you can see, and seasonal affective disorder is really all about light and exposure to light. I know some of us have associations with winter and cold and snow and maybe not liking winter sports or shoveling. And yeah, that all plays into it too, for sure. But mostly we're going to be looking at how the lack of light affects us. And you can see by this chart that, we're already well beyond the longest days of summer. And the biggest increase or noticeable effects of seasonal affective disorder, they do start in October and November. especially when there is daylight savings time and the change of the clocks. That really throws people off. But you can see that, we're like right here. And so let's like talk about from here to here and get ready for this so that we can smooth out the dip, smooth out the dip in the mood or the feelings of sluggishness. So I really am, again, I'm so psyched that we're here today in August and not in October talking about this. And this is just another chart that I pulled off showing the sunrise and sunset in Conway. And again, you can see that this is the daylight, so that we're already, losing quite a bit of daylight. And I don't know if anybody's noticed it yet. And then on top of it, we've had kind of a really rainy summer, haven't we? So I know I'm wondering if I'm going to see more people coming to me with seasonal affective disorder just because they didn't store up on their sun and vitamin D during the summer. So, we'll see how that goes. So yeah, just a real awareness that we're really well over the high summer and we're in late summer. And now is a really good time to start discussing it with the people we work with. And on the topic of normalizing, as you can see, I've got this chart here, some research that was done a few years ago, looking at the different latitudes and the prevalence of seasonal affective disorder and winter blues, which is just like a lower level of sort of subclinical low mood. And just it's interesting to compare and contrast, like you see in Sarasota, Florida, where the latitude is 27 degrees. It's very low incidence of winter blues and SAD, although some people still feel it even there. And then you can see how it changes through New York City and Nashua, which is our closest neighbor in this chart. So if you add up the seasonal affective disorder and the winter blues, it's 20%, almost 21% of people who are affected by this. So again, I think it's really helpful to not make this something that's weird or unusual or has a stigma attached to it. And it's interesting to look at Europe, and I'm going to talk about this a little bit. Oops. Oh, sorry, guys. Hold on. There we go. So again, Stockholm, Sweden, which is even further north than us, they have a high prevalence, and same with Finland. And then, so interesting, you look at Iceland, which is way up there, but their total report is much lower. And when I first read that, I thought, oh, it must be because they're so good at just being snuggly and, the hygge thing, hygge, where they get cozy and really embrace winter. But then I was reading that because Iceland for centuries was such an isolated place, that there's a theory that their gene pool just adapted better to the dark days than say even Sweden, where they've had more people coming and going, and maybe some they have more mix in the gene pool, people from the south who are now there and have been there for a few generations, and it's still affecting the level of seasonal affective disorder. But so yeah, basically the higher, the further away we get from the equator, the more we see seasonal affective disorder. And interestingly, other health issues too. So not just mood disorders, but there's a higher prevalence of certain cancers, and there's a really strong relationship with MS and lack of sunlight, and a few other health issues. And I have a resource that I'm going to leave with you guys so you can read more about that. It's pretty interesting how, again, like, let's not forget that we're human and we need sunlight for a myriad of different reasons, not just mental health. So the symptoms, when you look at the diagnostic and statistical manual, seasonal affective disorder at this point isn't a separate diagnosis. You'll see it listed under depression with major depressive disorder with a seasonal component. And so interestingly, they have really only been seriously studying seasonal affective disorder since the 80s, which is not in a very long time, considering how long we've been looking at depression. So a lot of the symptoms overlap with major depressive disorder, but including a real feeling of fatigue. There can be sleep dysregulation, sleeping too late into the morning, having trouble getting up, loss of interest in fun activities, particularly socializing. There's this feeling of hibernation that people tend to get. Changes in appetite, particularly weight gain and the carb cravings. The feelings of worthlessness and just not feeling connected. Cognitive sluggishness, so just having trouble concentrating. Maybe even, just feeling really out of it, fuzzy-headed, having trouble finding your words. Those are things that I see in my practice. And getting ready for this presentation, I realized I didn't know this, but it makes sense to me, my personal experience and in my practice, that it tends to be more problematic as we get into our 30s and 40s. So I put a question mark there because I wonder if that's going to change, right? Because so many of our 20-year-olds are behind screens, outdoors less. So I wonder if we'll see that trending down. But I think a lot of us probably have a sense that winter was more fun when we were younger. And maybe that's because we were outside more. And maybe we didn't have to shovel as much. I don't know. I'm not quite sure. But right now, the research says that there's an increase as we get into our 30s and 40s. But I'm curious to see if that's going to shift. So summer sad. I don't know who knew about this. I don't know if I can get okay. So there's a bi-seasonality to this. And some people have a negative change in their mood in the summer and they prefer the winter months. It's a smaller group of people, but it's definitely out there. And what we see in the summer sad folks is an increased inactivity, insomnia, decreased appetite, and even, agitation and irritability. So it's interesting to think about, again, like, we're humans and we are sensitive to these seasons. And, 200 years ago, we would have just we would roll with it. This time of year, 200 years ago in the Mount Washington Valley, we probably would have been in the garden, on the farm, outside 10 hours a day, storing up sunlight, storing up vegetables, getting ready for winter. And then when the days got short, we adapted. And now we're just sort of not living life that way. So I think we feel these effects more and kind of get down on ourselves because of it. So again, normalizing it, kind of smoothing it out is what we want to do with the folks we work with. But I also think, I'm thinking about, like, I think it's, was it Eric who works at Whitehorse, who's here? Like, I wonder, I'd be interested to see if in some of the inpatient places, if you see an increase of agitation in the summer, maybe more relapses. I'm just curious if there's any correlation in the population you work with.
I know one thing, Donna, in looking at overdose data, so publicly available sort of EMS data for Narcan distribution and overdose deaths tend to increase in the summer, but we don't understand all of the factors that play into that. But if you look at a sort of trend in overdose numbers, they do go up in the summer. Is that because people are outside more and in public? I don't know, outside more and in public spaces more. It's hard to tell, but that is something that you historically have seen is a spike in overdose
Yeah,
related
yeah.
outcomes in the summer.
Uh-huh. Yeah. So it's interesting to, and I know there's lots of factors, but you go to wonder, let's like add sunshine into one of the factors. Like, is there something going on where maybe people are getting too much light and it's causing like a hypomania situation? It's just kind of an interesting thing to look at. And interestingly, the treatment, if you're having summer SAD, is to like get less sun, like use sunglasses, diffused light. I was even reading some information about summer depression where you can use thermotherapy, like get into a cold river or cold lake, you know, to like kind of offset the heat and the agitation. So it's just good to know that that can be a normal reaction to our environment as well, and something to keep an eye on. So I'm going to talk about a few different treatments, and the first one is the light therapy. And so the full spectrum lights, I'm going to do a little show and tell now. This is a little, a tiny, well, it's a sort of a half-size model by the company Verilux. And again, I'll leave you with the link. And the treatment is 10,000 lux. This is a 5,000 lux light, and you'll see it's going to get even brighter as I talk. It takes a couple minutes for it to get up to full steam. The ideal treatment is 10,000 lux for 20 to 40 minutes a day. And people need to kind of experiment with it to see what works best for them. I have some clients who have a situation where, you know, they're okay in the morning, they get through their day, but they get home at 5 and they want to go right to bed, which can be problematic for their relationships at home. And so some people will split the dose up into 2 times. Like they'll do 20 minutes in the morning when they're having coffee, and then they'll do another dose in the late afternoon. You see how bright it's getting? And ideally, when you're using these, you want to have it to be like, you know, eye level. So ideally, I would be sitting here having my coffee. You don't have to look right into the light, but have it sort of near your pupils so that you're getting, you know, most of the light coming towards you. So it can be a nice ritual in the winter. Again, not even in the winter, but maybe starting September 1st to get your happy light out and start having your coffee or doing your morning meditation or whatever with your light. And then again, maybe using it again in the afternoon, depending how you're experiencing the symptoms. So, and I keep one of these on my desk almost year round. And frankly, this summer, I've been turning it on when we've had those gray stretches, because it's nice light to work to. The website says it helps with concentration. I think it's just really nice, bright, natural light. And I've never had any problems. Sometimes, not recently, but maybe during COVID when I was inside a lot and in my office a lot, I'd have it on a good part of the day and I never felt overstimulated. Although they say that's one of the side effects, but a rare side effect where it can cause some hypomania. So it's a little bit of something to look out for if you're working with somebody who's bipolar, true bipolar versus the seasonality. But it's pretty rare. And so, you know, other pros to this kind of therapy is that these lights are now relatively low cost. They used to be really expensive, like $500 and up. But now these are all, I think this one was $60, and you can get the 10,000 lux, the big one, for I want to say around 100. And they've got all kinds of nice models. I have another model just to show you that's more of like a, well, just a, you know, a desk lamp. And this one you can change the coolness and the warmth of the light, and you can also turn it up or down. So this is a newer model that I got last year. So those are just a couple of options. I really like the company Verilux. I don't have any financial association with them, but it's really the only one I've used. And I just feel like they're, you know, when you look at other lists of the best lights, they're always on the top. And they were a company that started in Vermont, so I trust them. It's a good product. Usually people will see a result in 1 to 2 weeks, so it's pretty fast acting. The cons, I would say, is you just have to be consistent with it. So, you know, some people struggle with that. Another thing you could tell people to do is just put a little one right by the bed and turn it on first thing if they're, you know, if they're really having trouble getting up. And they do have those sunriser units that kind of simulate sunrise. So that's another option. And another con, I guess I would say, is, or just an awareness, be aware that this does not increase vitamin D. It doesn't, you know, these lights are made to filter out the harmful UV. So that means you're not getting it's not going to help you increase vitamin D. And we'll talk more about that in a minute. So the other standard treatment, like other depressive disorders, are the serotonin selective reuptake inhibitors. And some people do take SSRIs just during the winter months, and it can be pretty effective. One of the cons, I would say, is that it can take 4 to 6 weeks to really start to feel the SSRI. It is easier to use. It might be easier for some people just to take a pill than to actually sit in front of the light, depending on lifestyle and whatnot. And the cons are the side effects that you can have with SSRIs. Sometimes it takes a few different tries of medication to figure out which one works for you. I did see in the research, the most recent research, that a lot of physicians like to start with Wellbutrin as the go-to for seasonal affective disorder. In my practice, I definitely see that Wellbutrin is one of the more stimulating SSRIs. And of course, the downside to that is it can cause anxiety, it can cause sleep problems. So, you know, you always have to weigh the pros and the cons with these options. So those are the two top treatments. And then, of course, we also have therapy. So cognitive behavioral therapy that when used separately, is as effective as light therapy and SSRIs, but it's also a great complement to either one of those treatments. Again, compliance and follow through is important. If you're having a client who has a kind of depression that particularly is sort of, you know, you're seeing them ruminate a lot and like worrying about winter. Like I hear a lot of people say, again, even in August, like, oh my God, I just am dreading the next 6 months. That might be a good candidate for talk therapy, because we would want to talk through like what is going on with your thoughts about winter. So sometimes there's a combination of, you know, true biological, chemical change from the lack of daylight, but also the ensuing thoughts, and we can kind of, you know, moderate those by, you know, having a plan. And so cognitive behavioral therapy is a great treatment, but you want to be proactive about it. So let's see. I want to make sure. Let's see. thoughts about, yeah. So looking at the actual thoughts versus what's going on physically for the person. A big part of cognitive behavioral therapy for seasonal affective disorder would include scheduling pleasant activities. We'll talk about that more in a minute.
We have a few minutes left on, and then I want to leave time for questions and answers.
Okay, great. So I'm almost done here. So another thing I wanted to talk about is another way to be preventative is to look at where your vitamin D stores are. And you can do that in a couple ways. You can go to a doctor, your PCP, and actually get a blood test that sees where your vitamin D levels are. Same with omega-3 fatty acids. If you're not having enough fish or eggs or flax, walnuts in your salad, you might have a little bit of a depletion of omegas. And you can like get these two supplements over the counter to just sort of shore yourself up, to get yourself in a better place to start the winter without even going to your doctor. On the other hand, you could go and see that, oh, I really do have a big vitamin D deficiency, and your doctor might actually give you a prescription strength for these. So these are things I always talk about with clients, these vitamins and nutrition and getting ready in terms of like getting your nutrition as good as it can be. Let's see. A couple other things. Methylated B12 is important for energy. And some people have a gene where it's hard for them to assimilate vitamin B. So the methylated version is really important. A couple other things I talk about, magnesium is a common deficiency in our culture right now. And it helps a lot with sleep. So if anybody's anxious or agitated going into the winter, it's a good one. Melatonin, you probably wouldn't want to use for SAD unless it was a, if your sleep got really thrown off from the time change, then you might want to consider that, but it can make you too sleepy. So a personalized plan, I might look like this when somebody comes to see me. I would definitely look at diet, exercise, and sleep. Those are the three biggies that I'd like to see people thinking about every day, and maybe even doing some kind of real simple log about how they're doing with those three. And it doesn't necessarily have to be outside, although getting natural sunlight, again, it kind of kills two birds with one stone. You're lifting your mood, and you're also getting your vitamin D stores up by being in the sun. The supplements, making sure people are like being kind of regular with their supplements or their prescriptions, looking at sleep quality, making sure it's not too much or too little, too light or too heavy. Levels of stress. Sometimes people just had a hard year and then they're going into the winter depleted. So that's something we want to help people with. Scheduling social activity, even if you are kind of forcing yourself a little bit. So that's something I can really help people with and coach people with in therapy. Watching screen time, substance use, and scheduling pleasant activities. And then this Nordic idea of, I guess they pronounce it hygge. I've seen it pronounced a few different ways. Of winter time is a time to be contemplative, connect with family, and be cozy, and kind of let yourself be a little sleepy instead of trying to, again, be a robot and just have the same level of energy every month of the year. Okay, that's it. This is just I think that's everything I covered, and I do want to leave time for questions. So
Thank you, Donna. Let's open the floor for questions. Go ahead and unmute yourself, and we're a small group, so.
It was just a comment I posted in the chat, but also I was looking at the weather on WGME, and they talked about how daylight loss starts to accelerate in August. So they said typically you can lose an hour and 20 minutes of daylight in Portland in August. So that's like, you're showing that those two curves where it's like the one going up, the sort of mood curve and the sunlight curve are starting to rapidly approach each other. So it's interesting and I guess on point, like you're saying, to have these conversations now versus and some of those preparation steps you talked about looking at different supplements or way to improve your diet to improve vitamin D stores, but like you said before, it's never too late, but before you're in a place when you're in a real deficit. So.
Yeah, it's true. It's never too late, but it's easier when you still have some energy left to get ready, for sure. I'm wondering if anybody works in the high school or, any comments about like, how is it like it kind of, when the kids get in the building, are they just inside all day? I'm just wondering if if there's some months of the year where they don't really see the sun at all.
Well, I can speak as a recent parent of a high schooler. The answer, of course, is it depends. Phys ed does move indoors, I think, largely, although there are some like adventure. There used to be an adventure something phys ed class where they would actually go out into the snow. There are kids who are, of course, compete in Nordic and downhill, and they're outside a lot, of course. There, and then culturally, we do have segments of our population that are outside hiking, hunting, snowmobiling. Of course, that's part of our regional culture. So I guess it varies. And then at the same time, it is also true that, we have a generation of a lot of people who enjoy gaming and enjoy being holed up in their room and, playing fun games online. With their friends. So I imagine, if someone spends a lot of time doing that, then they're not in the sunlight. So I imagine there's a mix of a lot of things going on.
Right. And I wonder, I had a client when I had my office in Cambridge who she was an admissions counselor at one of the colleges in Boston, and she was really struggling with the seasonal shifts. And I talked her into getting one of these tabletop lights and not be embarrassed by it. And she had a really funny story about putting this on her desk, and it was literally like moths to a flame. Like all her colleagues were like, wow, what is that? That's great light. And she was like, yeah, it's my natural sunlight for my mood and concentration and just normalizing it, and I wonder if I think it'd be a great idea if the counseling offices at the schools had a couple of these where kids could go in and just sit in front of them. Or, any place where
that's an interesting thought. Anyone else from the audience? Is any of this, what's resonating with you? What's standing out with you with all this information related to the work you do?
I was just gonna say real quick, a solarium would be nice, like in most schools.
Yeah.
And then I was gonna turn to Eric Eason for a question, but I hear Eric Moran jumping in. So Eric Moran, go ahead.
If someone is diagnosed by a clinician with seasonal depression, does insurance cover the cost of a light?
That's a good question, and I think it would depend on the policy.
Studies on people in jail.
Good point. It certainly would be a good thing to have in terms of regulating mood and behavior. And again, I think it's something that we need to talk about more and more because it just gets overlooked how important it is. And I will share with you the research on, like I said, the other physical ailments that are linked to lack of sunlight. It's kind of worrisome. So I think it's good for us all to keep aware of this and keep talking about it.
And I was just going to ask Catalina, not to put you on the spot, Eric Eason, but do you see any trends in call data for more northern climates that does calls to any of the rapid access points you've worked with in the past or in New Hampshire, do those data change as daylight diminishes, or is this stay mostly consistent?
I was actually trying to think through that as we were going through the presentation. The problem with our data right now is a couple of things. First of all, we only have about a 1.5 year data set, which is statistically speaking, not really a lot. And the other thing is that there have been so many factors around changes to the system, changes to the workflow, the introduction of 988, a change in the workflow for 988, and the change in the routing. There have been so many factors that it would really be impossible to tease out one thing over another with the data we have. Now, I do think that after maybe 2, 3, 4 years worth of data, we could start to look at those kinds of trends as things stabilize, but really just from the structure of the system having changed so much in the last 18 months, I think it's really this, we don't have good data to look at a trend like this just yet.
That makes sense. Are there any last questions for Donna or?
Yes, I had one.
Yes.
So excluding certain like mental health conditions like depression or bipolar disorder, do you find that there are like some populations more like, I'm trying to think of the word,
Susceptible or? Nah.
because I know that you said that it can affect anybody, but do you think that like certain mental health disorders, maybe like schizophrenia or borderline, do you think like certain populations like that might be more affected by seasonal affective disorder?
Yes. Yeah. And the research shows that if you have one of those diagnoses, schizophrenia was one, bipolar, and even anxiety, you know, you can have more of a chance of being, feeling the seasonal affective change. So again, you know, it's like sunlight is a great regulator. And we need to kind of remember that and remember how we lived just a couple of centuries ago, and honor that, you know. And again, it can be brought about to be you know, something that brings people together. Like, maybe we need to embrace more of a Nordic the ideals of getting together more, gathering during these cold months, sitting by a fire, storytelling. I don't know what that would look like, but it sounds really fun and cozy, and I think that would help people's moods a lot.
Yeah. Well, it reminds me of, you know, a message that I hear a lot among, you know, when you're in recovery communities, the conversations that, you know, connection is the, you know, the opposite of
Totally.
addiction, and that connection and community among, you know, human beings is such a protective factor against, you know, so many ills.
And I think, you know, sort of re-exploring, reconnecting, especially for young people who during COVID, you know, the 2 winters, 2020, 2021, were such high risk times that, you know, the message was to not get together, especially in the winter, when COVID is spiking. So I feel like some people in their formative years may have had a real wrench thrown into their, you know, what otherwise would have been a very different developmental time if COVID hadn't been there. So it's it definitely is a challenge. I think that sort of shook maybe younger generations, and all generations for sure, but younger generations more than we may have previously thought.
That's a really good point. And I think on this last slide, I had this little, pre-COVID, we used to have winter solstice parties. And so that was right at the beginning of the winter, and we'd like get to see everybody.
Right.
And then, you know, we didn't have them for a couple years. And then I think this past COVID winter, we just had a bonfire outside. So maybe that's a message we could give to those those kids they may have this, unconscious belief like, oh, we gotta stay isolated in the winter. It's dangerous to get together. And, now it's not quite that. We still have to be careful, but yeah, are there ways that we can create more opportunities to be outside by a bonfire? I don't know.
As someone who moved here from the South pretty recently, it was remarkable to me actually how I guess dead things get in the winter here.
Mm.
There's just so much less to do. I mean, far fewer events, far fewer, like it's strange, and then of course the spring comes, summer comes, and everybody comes alive, and it's almost like they're emerging from their shell. It's a very real phenomenon compared to my experience having grown up in the South. Yeah.
Yeah, and I wonder if we could do a better job of softening that. Like if you think of Montreal and Quebec, they have big winter carnivals, and I know we do have some around here. I feel like they're more related to specific sports. I wonder if we could do a better job of having some general opportunity.
Yeah, I feel like, ski and outdoor winter sports, they do embrace that more, but how do we engage people who may not be into those things,
Right, yeah.
Mm-hmm.
Well, this is all really important conversation, and I really appreciate you coming today, Donna. Valuable information. We will have the slides, and I'll check with you, Donna, whether we can share some of these in a PDF so that people can capture some of those tips and steps that people can take.
Sure.
Yeah.
Sounds great.
I'm going to stop the recording of this at this time.